In the battle against depression, finding the right medication is a crucial step on the path to recovery. For many individuals, the choice often comes down to Zoloft versus Lexapro. Both medications are commonly prescribed to treat depression and anxiety disorders, but what sets them apart? In this video, we unveil the ultimate showdown between Zoloft and Lexapro, providing valuable insights for those seeking the most effective treatment. When it comes to medication, it's essential to understand the nuances that differentiate one from the other. Zoloft, known by its generic name sertraline, belongs to a class of drugs called selective serotonin reuptake inhibitors, SSRIs, while Lexapro, or escitalopram, is a selective serotonin reuptake inhibitor, SSRI, as well. However, there are key differences in their mechanisms of action, side effects, and dosage recommendations that can greatly impact treatment outcomes. Join us as we delve into the nitty-gritty details of these two medications, comparing their effectiveness, safety profiles, and potential side effects. Armed with this knowledge, you'll be better equipped to make an informed decision about which drug may be the most suitable for you in the fight against depression. Let the ultimate showdown begin. Understanding depression and its treatment options. Depression is a complex mental health condition that affects millions of people worldwide. It is characterized by persistent feelings of sadness, hopelessness, and a loss of interest in activities once enjoyed. While therapy and lifestyle changes can be effective in managing depression, medication is often necessary to alleviate symptoms and promote overall well-being. When it comes to medication, there are various options available, including selective serotonin reuptake inhibitors, SSRIs, like Zoloft and Lexapro. SSRIs work by increasing the levels of serotonin, a neurotransmitter responsible for regulating mood, in the brain. By doing so, they help restore the delicate balance of chemicals and alleviate depressive symptoms. It's important to note that medication should always be prescribed and monitored by a healthcare professional. They will consider factors such as the severity of symptoms, medical history, and potential drug interactions before recommending a specific medication. Now, let's dive into the specifics of how Zoloft and Lexapro work in treating depression. How Zoloft works in treating depression. Zoloft, or sertraline, is a widely prescribed SSRI that has been available for several decades. It works by inhibiting the reuptake of serotonin, allowing more of the neurotransmitter to remain in the brain's synaptic gaps. This increased availability of serotonin helps regulate mood and alleviate depressive symptoms. One of the advantages of Zoloft is its versatility in treating various forms of depression and anxiety disorders. It is commonly prescribed for major depressive disorder, obsessive-compulsive disorder, OCD, panic disorder, post-traumatic stress disorder, PTSD, social anxiety disorder, and premenstrual dysphoric disorder, PMDD. This wide range of applications makes Zoloft a popular choice among healthcare professionals. When starting Zoloft, it's important to follow the prescribed dosage and allow sufficient time for the medication to take effect. It typically takes a few weeks for the full benefits to be experienced. However, it's worth noting that individual responses to medication can vary, and some individuals may respond better to Zoloft than others. This is where the comparison with Lexapro becomes particularly relevant. How Lexapro works in treating depression. Lexapro, or escitalopram, is another widely prescribed SSRI commonly used in the treatment of depression and anxiety disorders. Like Zoloft, it works by increasing the levels of serotonin in the brain, helping to regulate mood and alleviate depressive symptoms. One key difference between Lexapro and Zoloft is the form of the medication. Lexapro is available as an S enantiomer, which means it is made up of only one of the two mirror image molecules that make up the compound. This allows for a more targeted and potent effect on serotonin reuptake, potentially leading to increased efficacy. Just like Zoloft, Lexapro is prescribed for various forms of depression and anxiety disorders, including major depressive disorder, generalized anxiety disorder, GAD, panic disorder, and social anxiety disorder. It is important to consult with a healthcare professional to determine the most appropriate medication for your specific condition. Comparing the effectiveness of Zoloft and Lexapro. When it comes to comparing the effectiveness of Zoloft and Lexapro, it's important to consider individual variability and response to medication. What works well for one person may not have the same effect on another. That being said, several studies have been conducted to assess the efficacy of these medications. A meta-analysis comparing the effectiveness of various SSRIs in the treatment of major depressive disorder found no significant differences between Zoloft and Lexapro. Both medications were found to be effective in reducing depressive symptoms, with similar response rates observed. However, individual studies may show slight variations in outcomes, so it's important to consider the overall body of evidence. In addition to efficacy, it's important to consider factors such as tolerability and side effects when comparing these medications. Side effects of Zoloft and Lexapro. As with any medication, Zoloft and Lexapro may cause side effects. Common side effects associated with both medications include nausea, diarrhea, dizziness, drowsiness, insomnia, and sexual dysfunction. These side effects are usually mild and tend to subside as the body adjusts to the medication. However, some individuals may experience more severe side effects or have a higher risk of adverse reactions. It's important to discuss any concerns or potential side effects with a healthcare professional to ensure the medication's benefits outweigh the risks. It's worth noting that individual experiences with side effects can vary. What may be bothersome for one person may not affect another. It's important to be aware of potential side effects but also keep in mind that not everyone will experience them. Factors to consider when choosing between Zoloft and Lexapro. When deciding between Zoloft and Lexapro, there are several factors to consider. These include the specific symptoms being experienced, personal medical history, potential drug interactions, and individual response to medication. For example, if an individual has a history of sexual dysfunction with one medication, they may opt to try the other as it may have a different side effect profile. Similarly, if a person has a family history of a specific condition that may be exacerbated by one medication, the healthcare professional may recommend the alternative. Ultimately, the decision should be made in consultation with a healthcare professional who can assess the individual's unique circumstances and provide personalized recommendations. Personal experiences and testimonials. While scientific studies provide valuable insights into the efficacy and safety profiles of medications, personal experiences and testimonials can also shed light on the real-world impact of Zoloft and Lexapro. Individual experiences with these medications can vary greatly. Some individuals may find significant relief from their symptoms, experiencing improved mood and a better overall quality of life. Others may find that the medication does not work as expected or that the side effects outweigh the benefits. It's important to remember that everyone's journey with depression is unique, and what works for one person may not work for another. Reading personal experiences and testimonials can provide valuable insights, but it's important to approach them with caution. Anecdotal evidence should not replace medical advice or be used as the sole basis for decision-making. Consulting with a healthcare professional is crucial for obtaining accurate information and personalized recommendations. Consultation with a healthcare professional. Throughout this video, we have explored the differences between Zoloft and Lexapro, comparing their mechanisms of action, effectiveness, potential side effects, and factors to consider when choosing between the two. However, it is important to reiterate that the information provided is for educational purposes only and should not replace professional medical advice. If you are considering medication for depression or anxiety disorders, it is essential to consult with a healthcare professional. They will assess your specific needs, medical history, and potential drug interactions to provide personalized recommendations. They will also monitor your progress and adjust the treatment plan as needed. Conclusion and final thoughts. In the ultimate showdown between Zoloft and Lexapro, both medications have proven to be effective in the treatment of depression and anxiety disorders. They belong to the same class of drugs, SSRIs, and work by increasing the levels of serotonin in the brain. While there are differences in their mechanisms of action, side effects, and potential efficacy, the choice between Zoloft and Lexapro should be made in consultation with a healthcare professional. They will consider your individual circumstances and guide you towards the most suitable medication for your specific needs. Remember, medication is just one part of the overall treatment plan for depression. Therapy, lifestyle changes, and a strong support system are equally important in achieving long-term recovery and well-being. If you or someone you know is struggling with depression, reach out to a healthcare professional for guidance and support. There is hope, and with the right treatment, you can embark on a journey toward a brighter future.